Hello, everyone. I'm Beth, Executive Director of Cystic Fibrosis Research Incorporated, CFRI, and it is my pleasure and honor to welcome you to today's third installment of our webinar series on financial planning. So just so you know, the series will conclude in about 2 weeks with a webinar on special needs trust with Kirsten Howe, an attorney with expertise in these areas. And I do want to thank Global Genes for providing us with a financial advocacy rare patient impact grant to support this webinar. At any time during the presentation, please feel free to type your questions in the Q&A box and Beth will answer them at the end of her presentation. And as always, I want to remind viewers that any financial planning strategies discussed during this series are just that, strategies. And before making any decisions, please consult with an expert in your area to discuss your individual situation. And also before acting upon any information shared today, which is October 30th, 2020, please note that this information may change in the future. And so now, on to the substance. I am honored to be joined today by Beth Sufian. Beth is an attorney and director of the Cystic Fibrosis Social Security Project, which helps people with CF to apply for Social Security benefits. She's also the director of the CF Legal Information Hotline, which provides free and confidential information about laws that protect people with cystic fibrosis. An adult with CF, Beth serves on the CF Roundtable Board of Directors, where she writes a column about legal issues impacting our community. There is no better person to address this issue today. I thank you for being here, Beth, and welcome you.
Thank you, Siri. Thank you so much for having me and for having this series on financial issues. And for everything you do for CFRI, I think you're amazing. And during this pandemic, you have just brightened the lives of tens of thousands of people and provided so much helpful information and positive support. I'm just thanking you on behalf of the whole community. So we really appreciate, I know you are working night and day to figure out ways to help the community. And I think you're just making a big difference. So thank you so much. So the first thing I want to say is that, as Siri said, I'm on the board of the CF Roundtable, and I encourage you all to subscribe. It's free. You go to www.cfroundtable.com, and I not only write a legal column, but I have been posting blogs when new laws or new ways that people can be helped by laws happen. And so that's a really good way to keep up to date of what's going on. And as Siri said, I'm the director of the CF Legal Information Hotline and the Social Security Project. I am a 55-year-old with CF, so I definitely have had my own journey of trying to make sure I did have enough, not only finances, but also health insurance, which is of course very important for people with CF. So the CF Legal Information Hotline has had over 90,000 calls since 1998, and we provide free and confidential information on the laws that protect people with CF. It is operated by my law firm, CF Sufian and Passamano, and it is sponsored by the CF Foundation, but we are not employees of the CF Foundation, and all of the information that you tell us on a call is confidential. So we don't report any of the things that you tell us to anyone. We only report how many calls we've had each month to the CF Foundation. So I think sometimes people want to know that. But certainly at the end of this presentation, if you still have questions, which many of you may, because some of these issues are very complicated, please feel free to email and we will set up a time to speak to you. So it's cflegal@sufianpassamano.com. I know there are lots of emails out there that are not our email. So some people are email CF Foundation. Some people have emails that they think are ours, but cflegal@sufianpassamano.com. That's the quickest way to get us, and then we will schedule a time to talk to you. You can call us at 1-800-622-0385, but you will only leave a message because our whole law firm of 8 people is all working remotely. So it will take a little while longer for us to get back to you. So if you can email us, that would be great. And for anyone watching who works at a CF center, we do have these cards that you can give to your patients. And if you're doing telehealth visits for your patients, you're welcome to ask me to send you this card so you can email it. And then we do run the CF Social Security Project, which allows us to represent people with CF at no cost in an application for Social Security benefits and in a continuing disability review, which a lot of people don't realize. And so keep that in mind. We can help you more than once. So if we helped you 5 years ago and you now need our help with a review, we can help you again. And the gracious CF Foundation understands how important it is to have representation during a review. So if we helped you with a review 4 years ago or 2 years ago, and you have another Social Security review, we are able to assist you as long as we think that you still are eligible for benefits, obviously, and you can contact us directly. So how does it work if you need help with a Social Security, either application or review? You first contact us, we talk to you, we need to have you release your records for the past year to us. And then if we accept your case, you sign some forms, and then the representation begins. And there is never a charge for you, and we do not take a percentage of your benefits, which is the way all other attorneys get paid. So that's really important. And we do really appreciate, I know a lot of people with CF are online a lot. And we do appreciate if you hear that someone is having trouble with Social Security or needs information. We really appreciate all the times people suggest that people contact us. That's really, really helpful. There are still a lot of people with CF that don't know that they can get free legal help with Social Security issues. And when people try to do it themselves, it literally can take 2 to 3 years. And I will say that right now, Social Security representatives are working remotely. We were worried. We thought that was good because obviously with COVID-19, we are always happy for any group or company or employer to be allowing their employees to work remotely. But I think we were initially concerned if that would really slow down the process. But the opposite has happened because the employees really want to continue working remotely. And so they have increased their productivity by 40% to pre-pandemic, so pre-March of 2020. And that means that in many areas in the country, we are actually getting very quick decisions on initial applications and on reviews the same. So that, in terms of finances for someone who needs Social Security, of course, it's much better for the process to go quickly. And of course, no guarantee that your case will be decided quickly, but we are seeing dramatic, quick approvals. I think that is also because my staff, who are amazing, are working really hard. And of course, we are exclusively helping people with CF with Social Security. So we know how to do it. We've done it for 25 years. And I think also, of course, that has a lot of value to it. Okay. And so here's the card about Social Security. Okay. So what I'm going to do, I'm going to talk about a lot of different laws and strategies for helping people with CF in terms of their financial well-being. And you may not have thought of some of these, or some of these may not apply to you, but it's kind of a grab bag of all of the things that I could think of that might help people financially. And I'm going to try to just give a little bit on each topic and more on Social Security, because I know a lot of you want to hear about that. But hopefully this will be helpful. And then if a question pops into your head and you put it in the chat, then at the end, we will go over those questions. So the first two things I just want to talk about quickly are things that can help you, first of all, keep your job during the pandemic. So I just want to make people aware that if you are trying to work remotely, the Americans with Disabilities Act does allow workers to request a reasonable accommodation to accommodate your CF. And so I mean, literally, I think there are thousands of people with CF who have asked to work remotely and invoked the protection of the Americans with Disabilities Act, and their employers have agreed to let them work remotely. And of course, that is very helpful financially, because you can keep your job, keep getting paid, and also be safe at home. Some people in the past few weeks are contacting us to say that their employer now says, we've just decided you should come back to work in the office. I think at that point, the employee with CF can re-urge their request for the reasonable accommodation. And because the employee has already been working remotely, and if it's been successful and they're able to do the essential functions of their job, they should be allowed to continue working remotely. Now, I did hear from some people this week, and at the beginning of the pandemic, people, of course, were scrambling to get people with CF remote work. And some centers gave very small, short letters. And it sounds like some employers want a little more information. So you may find that you need to request a more detailed letter from the CF center that discusses why it's important for you to work remotely. So if you have other questions about that, let me know. Certainly, one of the ways that people can improve their financial situation and the depth of jobs that they can do is by going to school, by getting a degree, either by finishing their high school schooling, or after that, by going to college or technical schools. And so I think it's also important to understand that federal disability law, so the Rehabilitation Act of 1973, also gives a similar protection that's found in the ADA related to work. And that is that you do have the right to request reasonable modifications of school policies and practices to accommodate your CF. So lots of schools now are remote because of COVID-19, and that's really helpful for people with CF. If for some reason your school is saying that they won't give you remote work, I think as long as they get federal funds, and almost all schools do, I think that you can make sure you ask for a modification of the requirement that you be in person and that you be allowed to take the classes remotely. So I think that's really helpful. I think there are some people that have in the past gone to a federal agency called the Vocational Rehabilitation Office, and that's a federally that's a federal agency that is supposed to help people with disabilities find work. And sometimes they will help to pay for school or contribute to tuition for an in-state school. Sometimes they will help with money for books, and when people were living on campus, for housing. And so that sometimes is helpful. If you are on Social Security, vocational rehab says that the fact you ask for the vocational rehab help will not impact your ability to get benefits. But recently we see that it could trigger a medical review of Social Security. So if you're thinking of contacting vocational rehabilitation, I would say reach out to us at the CF Legal Information Hotline so you can make sure if you do get a Social Security review that you do have enough medical evidence to maintain your Social Security. I understand that there are some people that love to tell people that they should go to vocational rehab. And I think sometimes it is helpful to people, but I think people need to be aware of the risks, especially right now, when we think if you have Social Security, it's a good time to keep your Social Security and to make sure you reduce the risk that you will be reviewed and possibly terminated. Okay, so very quickly, another impact on your finances if you're working could be a time when you become unable to work. And if your employer offers short-term or long-term disability benefits, then you could apply for those benefits. And of course, that could provide you with some financial help. The really important thing, if we're talking about planning, is that when you get a job, if you are offered the ability to pay for short or long-term disability through your employer, you probably want to pay for that benefit. So we still have people calling us that say, yeah, my employer offered that and it was $2 a month, but I thought I'll never get sick and I didn't take it. So I hope that people never get sick if they have CF, but anyone can get sick. And typically these benefits are offered by big employers and it's not very much money for you to opt for the benefit. When you get sick, you cannot all of a sudden enroll in the short or long-term disability. Most companies say you have to enroll usually within 30 to 90 days of you becoming an employee. And after that, you don't get the chance to opt for that benefit. So it's a really good idea in terms of financial strategy to make sure if your employer offers this benefit that you opt for it. Because if you became unable to work, short-term disability has a pretty easy standard. You just have to show you can't work because of your health. It's not like Social Security. And long-term disability, you just have to show that because of your health, you're still unable to work. And so it's not very difficult to obtain. Recently, we have a few people tell me, oh no, my CF center told me it's much harder to get short-term disability than Social Security. And that's just 100% incorrect. And I think maybe they were talking about something else, or we really don't see people have trouble with short and long-term disability if they've stopped working and they have medical records that explain why the person cannot work any longer. So I know CFRI is located in California, and I am assuming some of the people listening live in California. And so California is one of 5 states, and then there's Puerto Rico, plus Puerto Rico, who offer a state-sponsored disability insurance program. That means that if you become unable to work, you can get a benefit that is paid by the state, so the state of California. And that's why most or a lot of California employers don't offer a short or long-term disability plan or just offer a long-term disability, because the state of California has the employers pay into a state system to offer state disability insurance. And in California, it works really well. You apply, it's not very difficult to fill out the paperwork, and you usually get approved quickly, and then you get a benefit for many, 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 many weeks. And so often people in California call this part-time disability, which I don't know why they do that, but it's basically a short-term disability policy that is offered by the state, and your employer has to have paid into the system for a certain period of time in order for you to get the benefit. And you usually get 50% of your wages. So now let's talk about Social Security. So for some people with CF, and about, we estimate about 50% of people with CF are receiving either SSDI or SSI benefits. And it might be a little higher. And so this is really important for people with CF. Very, very important. And even more important for people to understand the rules related to the two programs. And I know the reason CFRI wanted to have me speak is because in the prior sessions they've had on financial planning, that a lot of people who watched and wrote to CFRI to say, well, what about Social Security? What about people on Social Security? How do we financially plan if we're on Social Security? So that was the reason that she called me, luckily, to talk about this, because we do find that people on Social Security who have CF often are confused about the rules. And we definitely find that people who are not on Social Security sometimes would be eligible, but are confused about the rules. And most of the social workers have heard me speak many, many times and contact us, some of them daily, with questions about Social Security. But there are a lot of new social workers at CF centers. There are quite a few people who have retired in the past 8 months. From being a CF social worker. And so I do think there are a lot of new people who are luckily reaching out, but have no idea how these programs work. And it's just so important for any kind of planning you do to understand the rules related to the benefit that you have. So Social Security disability, you are going to have worked a certain period of time, and it's usually about 3 years part-time. It could be a little less, and then part-time, about 5 to 6 years, because you pay Social Security taxes into the Social Security system, and that's how they determine if you could get Social Security disability. You can go to SSA, which stands for Social Security Administration, ssa.gov. You can set up a personal account. You put in a password, your phone number, your Social Security number, and then scroll down and you'll see something that says, if you became disabled, this is how much money your Social Security disability check would be. And you may see, instead of that, you do not have enough work credits to get Social Security. So you haven't worked enough in the past 10 years to be eligible for Social Security disability, because they only look at the last 10 years of earnings, with more weight given to the last 5 years. So if you don't meet that work requirement, the benefit you may be eligible for is called supplemental security income. And that program is very different from SSDI, okay? Both programs require you be unable to perform substantial gainful activity. And both programs require that you meet certain medical criteria for benefits. So for Social Security disability, when you apply, on the day you apply, and every day after, while you are still while your application is pending and when your application is approved, continuing after, you cannot be working more than 15 to 20 hours a week in any week, okay? And 20 hours is the max. We like 15 because if you're working right up to 20 hours and you go over by, an hour, Social Security says you won't be eligible. So safer to do 15 hours. We like, if you're applying, you would be working maybe Monday, Wednesday, Friday part-time. So you can show that in between, you are able to rest. Certainly working 8 hours in one day, Social Security may find that they think that's evidence that you can work full time. So that's helpful. You cannot make more than $1,260 before taxes are taken out of your check for Social Security disability per month. And that's the 2020 number. Each year that number changes, so it may go up a little bit in January, but you don't want to work right up to 1,260 because they look at what you make before taxes are taken out, okay? If you're self-employed, the number is lower and the number is 910 a month before taxes are taken out. So here's the big, important news flash. Social Security disability only cares about how much money you are making from work and how many hours you are working, okay? They don't care if you own 7 cars. They don't care if you have $1 million in the bank. They don't care if your spouse makes $1 million a year. They don't care if your spouse has $1 million in the bank. They only care about how much money you are making from work each month and how many hours you are working, okay? So that usually reduces a lot of questions related to finances for people who are only receiving Social Security disability. Now, why would someone decide to go on Social Security disability? Often it is because when they are working full time, they don't think they have enough time to take care of themselves and they don't feel good. Maybe they have been on IVs a lot. Maybe they haven't. Maybe they have trouble with their diabetes. Maybe they're on a new medicine that is causing a lot of trouble with their stomach or with their mental health. So those are the reasons usually that people are stopping work to go on Social Security. I will say that since COVID-19 has happened, there are some people who have taken time off from work. Let's say they took the 3 months, March, April, May, and they were furloughed, or they took FMLA leave to stay out of work. And they found that when they were home and able to take better care of themselves, they felt much better. That is a person who could apply for Social Security. So the fact once you stopped working, you started feeling better, that is good evidence that you're not able to work full time and maintain your health. The standard for Social Security is not, can you work full time and have it make you very sick? Okay, so if you're working full time and you really can't take care of yourself, and you now have found that when you're not working, for either your business closed or you're unemployed, and you find your health has been improving, that does not mean you cannot apply for Social Security, because you have evidence that when you worked, you couldn't do your treatments, you couldn't take care of yourself. And now when you're not working, you can take care of yourself. You feel better, but that is because you have more time to take care of yourself. So I think that often gets lost in the shuffle with people with CF. So SSI is the other program, and SSI has a lot of rules related to income and assets and resources and where you get money from, and the list of rules for SSI is very long. And lots of people with CF who are younger are on SSI, and some people have been on SSI for many years, and those people are now older, but they're still on SSI. And SSI gives people Medicaid. So in the 13 states that have not expanded Medicaid to adults, one is Texas, one is Florida, like big states that have not expanded Medicaid. The way to get Medicaid as an adult is to have SSI. And that's why if you live in one of those 13 states, SSI and following the SSI rules becomes very important. Because whenever you are thinking about your finances, you want to account for your ability to have insurance coverage that will pay for the medicine and care that you need to manage your CF. And so when you are planning to either go on SSI or thinking of getting off SSI, typically, especially people in those 13 states, need to see how they would access insurance. So if you live in California or New York or one of the other 37 states that allows people who are low income adults to get Medicaid, then you have less of a worry if you lose SSI, because you can get Medicaid as a standalone program without having SSI. But Medicaid has a lot of similar rules to SSI, although many states have the ability to access Medicaid without SSI if you are disabled and working a small number of hours. We, our CF Legal Information Hotline has been working on a list of all of the states that have those work programs, because that's really helpful if you think you're going to lose SSI and you want to work a small amount. That will allow some people with CF to access Medicaid. So you'll see that if you're under 18, SSI looks at your parents' income and assets. So once you turn 18, they only look at the person with CF's income and assets. And that expands the ability of some people with CF to get SSI. But you have to have, if you're an individual or you're an adult with one child, you have to have $2,000 or less in resources. And if there's two adults and either one child or more, you have a $3,000 resource limit. So it's a very low amount that you can have for resources. They don't count one car and one house if the house is used for your residence. So just going back to SSI. So the other issue for SSIs, if you're on SSI and your grandmother gives you a check for $100 for your birthday and you put it in your bank account, that reduces your SSI check by $100. So for every dollar in unearned income, you have a reduction of your SSI benefit. Okay, so that's where you have to do some planning in terms of people giving you cash money. In addition, if you're on SSI and you get married, then the person you marry, their income and assets will be counted. So you want to make sure before you get married, if you're on SSI, you understand if you lose it, how you will get insurance. We have a long list of people right now who got married and they didn't realize they would lose their Medicaid. They live in one of the 13 states without Medicaid expansion, and they have no insurance right now. So that takes some planning. The other important thing, people don't like when they hear this, but I'm going to say it anyway. It's not funny, but it's the way it goes. Is that Social Security says if you hold yourself out as married, they consider you married. So if you have a ceremony, if you call the person that you live with your spouse or your husband or your wife, and that's in your clinic records, that is holding yourself out as married, and Social Security considers that being married. They can Google you, they can look at Facebook, even if you have privacy put on Facebook or any other social media, and that's how they are finding out if you're holding yourself out as married. So please do not read posts online that tell you you can just have a ceremony and don't get legally married, because if you're on SSI, having the ceremony is holding yourself out as married. I've been talking about this for 24 years, but every week I still get calls from someone saying, Social Security has stopped my benefit and I've lost my Medicaid because they say I was holding myself out as married. Okay, so a big issue right now for people who are on Social Security and are feeling better because they're on a new modulator, or maybe an old modulator, but most people it's because they're on a new one, is, will I be terminated from benefits because I feel better because I'm on a modulator, but I still don't think I can maintain my health and work full time? So make sure that you have accurate medical records that are talking about the time you spend doing treatments each day, if you take a nap, if you have to sleep 9 hours a day, if you have stomach trouble, how long are you in the bathroom? How many times do you go to the bathroom? Does your diabetes take a lot of care? Do you have mental health issues? Any other issues that you have, especially right now when a lot of CF centers are doing telemedicine, you want to make sure that you don't treat the telemedicine as a quick hello to your clinic and then you end the call. Telemedicine visits, they should be typing up what you say, and you want to make sure you're giving them information that can be put into your clinic record that will support a finding that even though you feel better, you are still taking time to do your treatments and have other self-care during the day. It's just very important to have that information in your medical records. Okay, so if people have questions about that. So if you have not been able to do your treatments because you've lost your insurance, or your insurance has denied a claim for one of your medicines, or you're very depressed, you're having trouble with anxiety, and that's the reason you can't do your treatments or all the treatments you're supposed to do. We have people that are homeless that don't have access to electricity to do their treatments. If these are the reasons you can't do your treatments, tell your CF center and make sure that you say, please put this in my record. Because if you have a reason for not doing your medical treatments, then it's really important to have that in your medical records. Okay, so if you were to get a continuing disability review, you obviously want to contact us, and we can help you, and we want you to have all of that information in your records. But you could lose benefits if you do a continuing disability review on your own and then you have to appeal, and those are taking a long time. So treat the CDR, the Continuing Disability Review, as a very important matter. We have people every week that call and say, I've been getting benefits for 10 years and I just didn't think the paperwork was important. And I don't even know what I wrote, but now my benefits have been terminated. So it doesn't matter how long you've been getting benefits. And just because you have a diagnosis of CF does not mean you get to continue benefits. But if you have records that talk about what you are doing every day for your health, that is, basically gold. That's what you need in your records. And also, of course, we can help you for free. We're the only disease group in the United States that has a program that will help people. Attorneys will help you who only handle CF cases for free. So take advantage of that service. Once you turn 18, you're also going to get a review, and things can get rather complicated. So also contact us so we can help you. So if you want to try to work, I mean, most people right now are not trying to work and get off benefits because of the pandemic. And thumbs up. I think that's a good idea. But there are a few, mainly younger people, a few older people who say they feel great now and they want to try to work some. So you can work under the 1260 or the 910 for self-employment. And you may, and I think that's the safest thing, like try it out before you jump off benefits and then decide that was a mistake, because then it could take a while to get back on. There is a regulation that provides for a trial work period for making over the allowable amounts, and it's up to 9 months. But many people think that it's mandatory that Social Security give you 9 months. It sounds sort of like that on their website. So that's probably why people think that. But the reality is, in new guidance and statements over the past year, Social Security has says this is permissive. They may give you 9 months, but they don't have to. If at any point they decide, boy, you're working making over 1260 and you're working a lot, we think that shows you can work, and we're going to stop benefits. So it's not a mandatory 9-month trial work period. But certainly if you decide you want to try to work making over the 1260, you hopefully will get about 3 months of a trial work period, but that's not a guarantee. They may only give you 1. But this is better than jumping off benefits and calling Social Security and saying, I'm off, I don't want any Social Security. Then you try your full-time job, it doesn't go the way you planned, and you want to get back on benefits. It can take up to 12 months in most cases to get back on. So in your efforts to financially plan for your future, make sure you take that into consideration. So there are there's 2 programs that deal with SSI recipients that no one ever seems to know about, but actually are good. So one is called Section 1619B. It's the section of the Social Security Code that says, if you're on SSI and you want to make over your allowable amount, you can do that, and they will put on your computer file that you're on 1619B, and you don't get your check, but you keep your Medicaid. And even better, if you find that you don't want to work that much anymore, you can contact them. And this is the only time that they should then start your check back up within about 30 days. That's not a guarantee it would be 30 days, but typically that's what happens. But we like when people call Social Security to say, I want you to categorize me as being in 1619B program. That's a really safe way to try to work if you have SSI. Social Security also offers something called the PASS program, and that allows you to come up with a plan to support yourself in the future by working and saving money for a work goal, either to go to college or start a business or go to technical school. This is a really good program because they don't reduce your SSI by the money you make if you're saving it for this work goal. So not a lot of people use either 1619B or PASS program, but the people who do really have a lot of benefit from them. Lastly, there's something called Ticket to Work. And Social Security has a lot of robocalls or people calling you, real people, and they are trying to get you to say you want to participate in Ticket to Work. So Ticket to Work gives you a ticket. Now I don't think they're sending out actual tickets, but initially they were. It looked like a ticket and it said your ticket to work, and you can get vocational help, not from vocational rehab, but from a private company. The private company gets paid if they place you in a job, in any job, not a job you want, not a job you're trained for, not your dream job, any job, then they get paid. So typically in the past 2 years, those jobs are fast food or retail establishments, which of course are a mainstay, especially for a lot of people who are young with CF. Many of them work in retail and fast food. But right now with COVID-19, I think most CF doctors think that those types of jobs put you at high risk of being cross-infected with COVID and possibly having a bad outcome. And so you may want to think twice about signing up for Ticket to Work. Ticket to Work could trigger a Social Security review. And because you've represented to Ticket to Work that you can work full time and want to, that could have a negative impact on your ability to get Social Security. So be aware of that. If you do decide to return to work and you have Medicare, here's part of your planning for the future. You want to make sure that you ask for something called continued Medicare eligibility. If you've qualified for Medicare, you've been on Social Security for, let's say, more than 3 years, and you decide you want to go back to full-time work, your Social Security disability check stops, but you could keep the Medicare for up to 93 months. And you do pay for Part B, but you can keep Part B as well. So sometimes that's really helpful to people. So a lot of people have asked questions about ABLE accounts. I think a lot of people have sent questions about that pre this event. And so I just want to quickly talk about ABLE accounts. That they were created by law in 2014, but the guidance for them came out in the winter last year, 2019. And what they do is they allow you to save money even if you're on SSI. So they allow you to have $15,000 contributed to the ABLE account each year, and that money is not taxed, and that money doesn't count towards your SSI resource limit. It has a maximum amount of $100,000 total that will not be counted for SSI. So the trick is when you look online, it says you can have a maximum of 350,000. Some states say 360,000, but only 100,000 is not counted for SSI. So that's a little tricky. So 100,000 is going to be your max that will not be counted. There's only certain people who are eligible for an ABLE account. It's someone who has SSI and that they've had it before turning 26, or they're entitled to disabled widow's benefit, which is rare for anyone to get that before 26. Or if you don't have SSI, there is a process of being certified as meeting all the requirements for SSI before 26. So ABLE account is not for everybody, but it could be helpful for people with SSI. When the person passes away, who is the disabled person who has the ABLE account, then that person has to reimburse, or that person's estate has to take the money from the ABLE account and pay Medicaid for any payments Medicaid made for the beneficiary. So that's called a Medicaid payback provision. So I think that's helpful to know. Very important when you're doing financial planning, if you're going to leave SSI or SSDI or you have CF, part of financial planning will be making sure you have insurance that will provide you with the best coverage you need. And also, of course, people want with the coverage that will have the least amount of payments out of your pocket, right? So Medicaid is going to most likely have the least payments coming out of your pocket because you don't pay a premium, and in most states you don't pay any copays. So that's really helpful. Medicare has some copays and some premiums for Part B and D, but you can, if you meet certain low-income criteria, have those premiums waived. So the other option, of course, is employer-based insurance, either through yourself or if you're under 26 through your parents. And then the Affordable Care Act, for hopefully, as long as we have it, which is hopefully going to be a long time, the Affordable Care Act offers you the ability to purchase insurance on healthcare.gov, which is a healthcare exchange. And if your income is below the allowable amount, and they have pretty high cutoffs, 45,000, I think it's about 45,000 for someone who is single, family of 4, I think is like 96,000. And then you can get premium help. So this is a really good way to get insurance if you don't have it, especially if you've lost your job or your spouse has lost their job, or you are on your parents' plan and they've lost their job. Healthcare.gov is where you go. And the open enrollment is coming up, but if you've lost your job and lost your coverage, you can get special enrollment. Now, COBRA allows you, if you've lost your job, to continue insurance. And you usually only have a short period of time to enroll in COBRA. So this is something new. It's called a joint rule. So it wasn't an act of Congress, but it was a rule change by the Department of Labor and Treasury that says, during the period of the COVID-19 national emergency, starting March 1st until 60 days after the end of the emergency, you can elect COBRA beyond the 60-day period that usually people have to elect COBRA. So if you lost your job 5 months ago and you thought you were going to get another job, so you didn't take COBRA, you can still elect COBRA. This is like, nobody knows this, but it's true. And it's really helpful if you find yourself without insurance. So let me know if you need more information about that. And lastly, for insurance, if you reach the limiting age on your policy, on your parents' policy, so the limiting age is 26, before turning 26, a few months before, you would ask for paperwork from the insurance company to certify that you are still a disabled child. You don't need to be on Social Security. And what you would do is have your doctor certify that you cannot self-support because of your health, and that your parents are paying 50% of your maintenance. That can be paying for lots of different things. Then you can stay on your parents' insurance under state law. The only states that don't have this law are Oregon, Oklahoma, and Kansas. But every other state has a state law. And this is a really good way right now. If you're about to turn 26 and you don't have a good option for insurance and your parents have great insurance, this is a really good option. So I'm just going to throw out a few things. I know we have about 4 minutes, and I had more things to say than I thought, but I'm going to throw out a few more things, and then we'll go over questions so that if people need to leave, that's understood, and you can contact me if you don't hear your question. But I do want to quickly talk about another sort of financial issue for people, deals with student loans. So you've gone to school and you have a lot of loans, and now you are not able to work or you've lost your job, and you can ask for a student loan discharge because you were unable to work because of your CF. So the loan provider will send you a bunch of forms and you will have to fill them out, and your doctor will usually have to state that he doesn't think you can work at all for a period of time. Some of those forms say 3 years, some of them say 5 years. Lately, we're seeing more that are 3 years. And then if you get the loan discharged, you can't work at all for that period of time. So if you only have a $2,000 student loan, that might not be worth it because you don't want to give up working for 3 years, or you feel like you might be able to work in the next 3 years. But for people who have very large loans, who are finding that it's helpful not to be working, I think it's worth exploring the student loan discharge. And you don't have to be receiving Social Security to get the student loan discharge, but you do need the physician to certify he doesn't think you can work at all. He or she, sorry, he or she. And so you would have to discuss that and why you think that's true. And there may be tax consequences for the discharge. I think someone has just told me that that the tax implications now have been changed. And so there's a low likelihood of having a tax implication, but certainly this is important. I know some people have asked about if they participate in research or they participate for an organization, they do a survey and they're going to get a gift card as a thank you. If they're on SSI, do they have to report the gift card? So believe it or not, SSI has a regulation dealing with gift cards. If the gift card can be used to purchase food or housing, SSI says that is unearned income that will reduce your check. If the gift card cannot be used for food or housing, the SSI rule says that gift card will not be counted. So that's really important. I know CFRI is going to have someone talk about special needs trusts and a whole session on that. And the only thing I want to say about that is that you cannot use money that's in a special needs trust for housing or food. You can't do it. And just keep that in mind, because there are a lot of people who tell you that I am wrong, but that is correct. And you cannot use it for housing or food. So if you have a parent that puts a lot of money in that special needs trust and you end up wanting to use the money to purchase an apartment or pay rent or buy a house, then our opinion based on the rules is that that is not allowed without jeopardizing your SSI. So, all right, I'm gonna look at the questions and let's see. Someone says, I've never heard of the U.S. Vocational Rehabilitation Office. I thought that was a state-run function. So it is a federal program, and each state has an office. So it is a federal program, though. Okay. Just like Medicaid is a federal program, but it is administered by the states. So someone is asking, if I'm on SSDI and get married, does that affect my SSDI? So SSDI, you get married, they only care about you working and how much money you're making from work. So it does not affect SSDI, and it does not affect Medicare, but it will affect Medicare if you are on a low-income Medicare plan. So if you're on a low-income Medicare plan and that requires your household income to be below a certain amount, if you got married, you may not be eligible for that plan. You'd have to see how much the person you marry has in assets or income. But if you are also on Medicaid, Medicaid is a program for people who are low income, and the fact you get married will affect your eligibility for Medicaid, and it will depend on how much money your spouse has, how much money your spouse makes from work. So the Medicaid could be impacted. So someone says, if I get a gift for participation in an activity or survey, does it affect SSDI? Again, SSDI only cares about money from work activity. So the issue lately, which we are getting lots of calls about, are people who are getting paid to participate on committees. So for example, CF Foundation may have you work on a project or a committee and you get $500, or there are other groups that say, hey, if people with CF are contributing to our group, we want to give them payment. So while I think that is, great, and I know there are a lot of advocates with CF who have really pushed for people with CF who are contributing to different groups to get payment, I think that can be seen as work income. And so you want to make sure that the amount they're paying you is not going to put you over that 910 self-employment amount, because you usually get that money not as an employee, but as an independent contractor. And so if you're on two committees for two different groups and all of a sudden you've got $2,000 in a month, then you're over the allowable for SSDI. So you want to be really careful about money you're getting from groups to be involved in their committees, or, plan a program, things like that. You get an honorarium for speaking at an education day. All of those things are going to be considered usually as self-employment, and you're going to need the 910 limit before taxes are taken out for SSDI. Is 1619B the long-term medical waiver in Florida? No. So 1619B is for people on SSI who stop getting the SSI check but keep their Medicaid. Is it true for SSDI if you have not worked in the last 10 years, you are ineligible? I was a homemaker and didn't work in the past 10 years. So Social Security will look at your work record for the past 10 years. So typically, if you haven't worked at all, you won't have enough work credits. But you could see if you go to ssa.gov, it's the best thing is to look on your personal account on the Social Security website to see what it says about eligibility for SSDI. If you have never worked, you will not have any work credits and you won't be able to get SSDI. And the next person says, well, how long would it take? How long would you need to work? And so it does matter how much you're making. So the more money you make, then the quicker you can get the work credits. But you usually have to have worked 3 years full-time or 6 years part-time, but it will depend. Like if you work 1 year, you make 100,000, then you work 2 years making 10,000. You may have enough work credits, you may not. The best thing to do, the only way to know how many work credits you have is to go on ssa.gov, set up a personal account and check. That is literally the only way to figure it out. So it may be 3 years for you, it may be 4, it may be 2. You need to check on ssa.gov. So that's really helpful. Let's see. Someone is asking, how can you see what is in your clinic record? On November 2nd, I think that's Monday, right? Or I think that's Monday. On November 2nd, there is a new federal law, that a section of a federal law that is coming into play that should make it easier to get access to your records, but usually you can just sign an authorization to release records and you can get your records. And in the CF Roundtable current issue, there is a great article by the wonderful Amy Silvas on obtaining your medical records and making sure you have accurate records. I strongly encourage you to read that. It is on cfroundtable.com and the author is Amy Silvas. I think that's a really, really helpful article. So someone is asking about, if you're on SSI, why do they reduce your check if you don't have a rental agreement with your parents? So I spoke yesterday at this very big medical conference and there was like 400 questions on rental agreements. So it's a little bit of a complicated thing, but I think it's really important if people are on SSI and really important for CF centers to understand it, for parents to understand it. So once you turn 18, if you are living with your parents and you are not paying rent, Social Security will reduce your SSI check by 1/3 because the SSI check is supposed to pay for your housing and food. So in most states, you get $783 a month. So you get about a $250 reduction. California and New York pay more. So your reduction would be a little more. So the way around this is to have a rental agreement to pay your share of household expenses, and you can pay for your food separately. And what you do is you have a worksheet from Social Security, and you figure out how much money is rent and gas, electricity, utilities, and taxes, if there's like a mortgage tax, and then you divide it by the number of people living in the house. So if that number comes to 2,400 and there are 4 people living there, your share as the person with CF is 600, and you have to have a written agreement to pay your share. If you don't, they give you the household deduction. So we are very hopeful. We think this is going to happen. We think that we will have funding. We hope we will have funding. We think we will, and we hope we will, on January 1st to help people with household deduction issues, which is just, very exciting because it's really hard to do that yourself. But if you don't have the rental agreement, or you're lucky, your parents, live in a really nice house, and their mortgage is $6,000 a month, and there's 3 people living there, your share would be $2,000. You can't pay that with your SSI check, so you get the deduction. So that's how that happens. Okay, let's just see. I have a child with CF who is on Medicaid. Is he eligible for SSI? Great question. So if you're on Medicaid, that means you most likely would meet the low income criteria for SSI, and then you have to meet the medical criteria. So the child has to meet one of the medical criteria, or an adult does too. And I didn't go over the medical criteria because what happens when I do that is people get obsessed with one part of the medical criteria and decide they're not eligible. And so there's 10 different listed criteria: hospital stays or home IVs or low FEV1 or diabetes in a G tube or on oxygen, lots of other things, or your condition is as severe as the criteria. So what we like people to do is, if you want to determine if you may be eligible for Social Security, give us an email and we can talk to you on the phone to see if we think you might meet the medical criteria. I will say one thing, that some children get Medicaid and there's a waiver of the parents' income and assets. SSI doesn't do that. So if you are getting Medicaid for your child who's, let's say, 17, and you are over the income criteria for Medicaid, but you have a waiver, then you won't be able to get SSI, because a child under 18, when SSI looks at that child's application, the parents have to have low income and low assets. Okay, let's see. So someone says, I have Medicaid, how can I save money without being kicked off? So the only way is going to be through that ABLE account or through the special needs trust. Otherwise, if you're on Medicaid, you have to meet that either $2,000 threshold if you're an individual, or $3,000 if there's two people or more in the family. So unfortunately, if you're on Medicaid, if you're on SSI, you can't save money unless you're putting it into the ABLE account, which will allow you to put up to $15,000, or you have a special needs trust and money is put in the special needs trust. So I think, a lot of times people think, well, there must be other ways to save money if I'm on Medicaid or SSI, and there just aren't, because those are programs for people who have low income and low assets. So you've been great to stick with me, and I appreciate you listening. I have sort of like a little Halloween thing to say Happy Halloween, and email us if you have questions, and I appreciate you all listening.
Beth, thank you so much for this incredible presentation. And the fact that we have gone on so long really speaks to the incredible need for this information and what a phenomenal resource you are for the CF community. We are so grateful to you. So everybody's watching, this is being recorded. We will release it as a podcast so you can come back. I know it's so dense with important information. I also invite you to come back on Wednesday, November 11th for that webinar on special needs trusts. And again, the references to CF Roundtable, if you haven't subscribed, you really should. It is just, again, another wonderful source of information and connection to our community. So as always, Beth, it is a true honor and privilege to be with you. Thank you so much for sharing your time with our community.